So please join me in welcoming Leslie Michelson to the stage.
Thank you so much. Thank you. For all time, a very few people, have lived long lives, very long lives. Bible students tell us Eve lived to be 940. Looks pretty good, don't you think? Noah, 950. Methuselah is beginning to show his age at about 969. Abraham, 175. And Joseph, perhaps because of all that color in his coat, just made it to 175. Chinese legend has it that one of their leaders, 3,000 years ago, lived for 800 years. In Polish history, they talk about one of their kings living to be 120. I don't know about all that, but I do know this. There's an organization called the Gerontology Research Group in Los Angeles that documents very meticulously and verifies the ages of the oldest people in the world. They've now documented about 1,500 people who they call supercentenarians, people who lived over 110 years. The longest documented lifespan of a human being on planet Earth documented is about 120 years. Let's look at average life expectancy. This is a chart. You typically don't look at time series that go back 12,000 years, but let's look at it. It's pretty good. Average life expectancy for human beings on planet Earth over 12,000 years, been pretty flat. 20 to 40 years, depending on what's going on. It's all within the noise of the numbers. That basically existed until about 120 to 150 years ago. But things have changed. In this century, in the past 120 years, average life expectancy on planet Earth went from about 31 to about 67. Life expectancy in the United States of America, the turn of the century, the 19th century, 114 years ago, was about 47. It's gone up 60% to about 80 years old right now. By the turn of this century, a lot of improvements were made, particularly in the first 50 to 60 years of life. So what are the technologies that we used to bring about those improvements? It was hygiene. We didn't know that you needed to wash hands because your hands contained dirt. It was anesthesia so you could do surgery. It was better childbirth and surgical techniques, vaccines and antibiotics to defeat infective disorders, clean water, better and more abundant food so that people are not malnourished, better education so people can think through how to do things, better contraception so women can get control of their lives and their destinies and control how their family proceeds, safer workplaces, and even though the tort lawyers disagree, the world has become a much safer environment. But all these technologies are coming together in something that we call technological convergence. As they come together, it's not additive, it's multiplicative. One technology enables somebody to use the next technology more successfully. We now have something that we never had before. We've got global collaboration. So people literally around the world are helping us, helping one another with biomedical research. I believe that in the next 50 to 60 years, 40 to 50 years, the major improvements in life extension are not going to come in the first 50 to 60 years of life, like the slide I put up earlier. But here's a phrase you've probably never heard before: the second 50 to 60 years of life. Well, what's the new technology? It really bears very little relationship to the old technology. We could all pronounce the words that I just used. Difficult to even pronounce all these new technologies that are happening now. You see them on the evening news, you read about them in the newspaper, your friends talk about them. The biotech industry is exploding. We're doing biogenomics and genetics and DNA sequencing. We have stem cells. We have all sorts of imaging using all kinds of technologies to see things from inside of the cell, to be able to remotely sense deficiencies in our blood flow and identify defects in our spinal canal. All these things are happening today at a remarkable speed, and it's all being turbocharged by informatics, investments in robotics, nanotechnology. I could literally spend the entire day articulating all of the new technologies that are now maturing. But one of the things that we've been working on since 1953, the early 50s, when Watson and Crick discovered DNA, was figuring out how to sequence the human genome. The National Institutes of Health made a commitment in about 1990 with a $3 billion commitment to sequence the human genome. It took 10 years. It cost $3 billion to sequence one human genome. Transformational technology. By the year 2000, the human genome, the first draft, was reported publicly. I think it's an interesting irony that that's the way the century started, right? With the reading of the human genome, because that capability is going to define everything that happens that's important this century. By the year 2001, it was about $100 million to sequence the human genome. And in the past 6 months, there's been a major breakthrough. There's a company by the name of Illumina that has introduced into the marketplace a $1.5 million machine that enables you to sequence the human genome for $1,000. I don't think that there's a technology that will have as profound a consequence for the well-being of the human race as the capacity to read the language of life for less than a ticket from LA to New York. Doctors every place are excited. Researchers are excited. We're using that technology now to identify rare diseases, single gene diseases. You've heard of some of these diseases: Huntington's, cystic fibrosis. If you have a particular gene, you have that disease. There are about 2,000 that have been identified. We're using this technology to prevent them and to treat them. None of us gets out of this alive. Hopefully, all of us stay in it for a very long time. But let's look at it. I'm a quantitative guy. What are the things that are likely to get us? It's two things. It's heart disease and cancer. It's cancer and heart disease. Collectively, they represent about 50% of all deaths in the United States. So let's focus on what we can do on both of those. The entire paradigm on cancer has changed profoundly. Up until about 10 or 15 years ago, cancers were all characterized by where was the organ that the cancer presented in. Was it the breast? Was it the lung? Was it skin? Was it the colon? The treatments we're all too familiar with, sadly. Surgery, disfiguring, difficult surgery, X-ray radiation, and chemotherapy, with people losing their hair and becoming very sick as a result. That's cancer up until about a decade ago. The whole paradigm for thinking about cancer has changed. We now look at the cell surface markers. We can see the particular things that that cell is doing that result in it growing out of control. And we're looking at the particular genetic mutations, because cancer is a disease of a genetic mutation that we can treat. And now we have fundamental different treatment technologies. The armamentarium leaves the prior technology in the dust. We can use robotic surgery. We get much better outcomes. The recovery is much better. Stereotactic radiation, it's a mouthful. But what it enables you to do is it'll deliver a lot more radiation with much greater precision, so you can destroy more of the cancer cells and have fewer side effects. We have immunotherapy, I'm going to talk about in a minute, where we can harness the immune system to defeat the cancer cells, and we're using monoclonal antibodies in a variety of different ways. Let's talk about cardiovascular disease, because it illuminates another dimension of this, and it's the other big killer. Here's the story. In order to understand the story, you need to know one thing about biology. Everybody's familiar with cholesterol, right? Everybody know what your cholesterol is? If you don't, you really should, because if you have an elevated LDL, low-density lipoprotein, that's the lousy cholesterol, that puts you at a very significant risk for cardiovascular disease, and it's highly treatable. So if you have an elevated LDL, you should treat it and you should move it down, because for every percentage reduction in LDL, you get a comparable percentage reduction in cardiovascular risk. So this story starts about 14 years ago in France. On May 5th in 2000, a group of French researchers identified 3 generations of a family that had exceptionally high LDLs. Normal LDL is 80, 100, 120, 140. every member of this family had LDLs of 400 to 500. Very, very high levels. And they found a particular gene that had a particular mutation that was causing that very elevated cardiovascular risk. That's where the story starts. Look at the global collaboration. The next step of the story is in Dallas, Texas. A group of researchers said, you've identified the gene, you've found a mutation that elevates the risk, so we know where the control point is. Maybe we can find a mutation that reduces the risk. They went into a large database, they used sophisticated technology, and they found a number of people who had a particular mutation on one of the two pairs of their chromosome that resulted in a mild reduction in LDL. So they said, maybe we can find a married couple where both have that particular mutation that reduces LDL and reduces risk. They found in their database one couple. They paused for a moment, as we all do in those circumstances, and said, dear God, let's hope they have a child. And if we have a child, we're going to see what this can do. It turned out that they had a child. The child was 32 years old. She had both copies of this protective mutation or allele in that particular gene. So what they demonstrated is if you have both of those favorable mutations in both of your genes, you can dramatically reduce LDL. The story then goes to Zimbabwe, where they found a woman in a maternity clinic who had an incredibly low LDL. They did a sequence on her DNA, and they found the same thing, so they knew they were on to something. And that started an international race with incredible intensity, in which Pfizer and Amgen, Regeneron and Sanofi are all racing to get a drug into the marketplace to treat this particular mutation. Here are the early results. Statins, we're all familiar with statins. They can reduce LDL to about a level of 70 or 80. These new drugs, they're called PCSK9 drugs. They reduce LDL by another 50%. Taking it up to the sky, we've got a brilliant entrepreneur in Los Angeles, Patrick Soon-Shiong. He's regarded as the wealthiest person in my hometown of LA. He's a brilliant physician. He's a visionary. He has a vision of taking all these technologies and integrating them so that all the information that's coming out and is becoming available about you and you and you and you can be combined to help everybody. Here's the visual on it. There's so many different sources of information that we can collect on individuals today. The challenge is, how are you going to integrate it? So he's creating technology to put it up in the cloud and make it available. I just want to go through, and then I'm going to pause, of a couple of different things that we're working on now that are in the market today. You can get an electrocardiogram on your cell phone. For $200, you can buy that this afternoon and get it delivered next week. It's about the size of the battery pack, the extra battery pack you put on a cell phone. You put both hands on it, you get a 2-lead EKG. There's another auxiliary thing if you need a 12-lead EKG where you could put them on. So just imagine for a second you're somebody that has cardiovascular risk, okay? And you're starting to feel a flutter. You take out your cell phone, you put your hands on it, and you can have an app that will communicate directly to your physician to send your EKG to your physician wherever you are. It's only a matter of time until that app has your historical EKGs loaded in it, detects a difference, assesses the significance, summons an ambulance because it knows where you are, downloads your records to the EMT in the ambulance, and gives that ambulance using Waze, do you use Waze? The fastest route to get back to the hospital. When you have a heart attack, there's the golden 60 minutes before the heart tissue begins to die. We've just saved you half of that. Imagine the consequence, and it's just technology. There's apps being developed, the genome for the iPhone. So once you know what your DNA is, you're going to be able to go on your iPhone and find out what your risks are. There are people that are developing smart diapers for infants and for the elderly so that you can detect information about that to find out if you have a urinary tract infection, if you're dehydrated, if you have kidney disease. All right? GE has manufactured now a pocket-sized ultrasound that would fit literally into your pocket for $8,000 that can give you the imaging that heretofore was only available on these large and very expensive consoles. And Medtronic finally, after years of trying, has introduced into the market an artificial pancreas so that patients with diabetes can get safer and better control of their blood glucose and their insulin. This is what's happening in the world. I started working on a book 18 months ago that's going to be published in January that can teach everybody how to navigate through this increasingly impenetrable system to get the very best care. But most emphatically, most poignantly, most significantly, and most joyously, there are going to be a lot more people living a lot longer and a lot healthier lives. So as I conclude, my hope and prayer for each and every one of you, for all of your clients and everybody who's important to you, is that you get one of these birthday cakes. I intend to get one, and my hope and prayer finally for everybody is that this very last one is yours. May you have lots of candles on your birthday cake. Thank you. Thank you so much.